public health journalist from Croakey, and we're up early in Newcastle, north of Sydney. I'd love to say it's a beautiful day. It's a little bit grey and overcast. I'd like to acknowledge that we're on the country of the Awabakal people, and we're about to do a Croakey Go, which is an act of walking journalism, walking and talking. This Croakey Go is being held in association with the Journalism Educators and Researchers Association of Australia conference. So we're asking people following the walk to use two hashtags. One is Croakey Go and one is JERA17, which is JERA17. We've actually got quite a few people joining the walk, which is lovely. There is one group here, and over here we have another group who are being periscoped by Croakey's contributing editor Summer May Finlay. So I'll just ask this group to introduce themselves. Hello, can you tell us who you are and why you're here?
Hello, I'm Hilary. I'm from Bellingen. I'm a science editor. I just happen to be visiting a friend down here, and I edit a lot of things in health for people like WHO, a lot about the lack of investment in covering diseases like malaria, in preventing diseases like malaria and TB. And so I'm interested in the lack of coverage that gets.
In the media?
Yeah.
Okay, and at the journalism conference we've been hearing a lot about the cutbacks in the media industry, the number of journalists who've lost jobs, etc. So these are all very relevant. Hello.
Oh, hi, I'm Dr. Beverly Patterson. I'm local to Newcastle. I'm an epidemiologist and a conjoint with the university here. I'm interested in infectious diseases. I work a lot for organisations such as the World Health Organization, the Red Cross, write a bit for The Conversation, and yeah, I'm just interested to see what the walk's all about and Croakey Go.
Okay.
Thanks.
Thanks for joining. Hello, would you like to introduce yourself?
I'm Anthea Garman. I'm from a university in South Africa where I teach journalism. Well, I suppose the thing that got me here was walking. I'm very interested in walking. I'm interested in walking cities. And I'm interested in, well, kind of like discovering a place in this way if I'm brand new to it. But I'm also interested in the work of Croakey Go, so I'm hoping to learn things today.
Okay, great. Well, Croakey Go is an evolving platform, and here we have someone who has direct family connections to Croakey Go.
Yes, my name's Helen Fierdegill, and I'm Ruth Armstrong's sister, and I've been asked to come because she couldn't make it here today, but I also am very interested in the issues of post-release drug and alcohol, which I manage programs for Samaritans, and I'm very interested in how the connection with health and journalism and how that we can improve the access to health for people exiting and people within the prison system and the justice system.
Such an underserved area.
It is a very underserved area, and it causes a lot of problems and costs a lot of money. So it would be great if we could just get some services into the people while they're in prison, so they can get some help.
How do you think journalism could help there? What could journalism do?
Journalism does a lot for all the things that we do, because it gets the word out, and once people get to know stuff, then it puts pressure on people who are in politics to make some better decisions about people's health.
And at the conference yesterday we heard from two of the Newcastle Herald journalists who've done a lot of work I guess around public health, Joanne McCarthy.
Yes, she's fantastic.
And another one of her colleagues as well.
Yeah, no, it's
And
great.
Just to explain, Dr. Ruth Armstrong, your sister, is one of our editors at Croakey.
She is, and she's brilliant.
We love working with Ruth. Hello. Could you please introduce yourself?
Yes, my name's Kate Saint. I work for New South Wales Health, and I'm undertaking a program or a project for the board for the local health network around health literacy. So I think it's the Toe in the Water project, and we're really excited that it's going to have some impact on the outcomes of people being discharged out of hospital. I'm also very interested in I spent most of the last 30 years doing WHO work, and I have a passion to improve the inequities and disparities in Aboriginal and Torres Strait Islander health.
And what role could journalism play there?
Positively and negatively, I think. To be realistic, I think a lot of people, including journalists, probably don't understand the impacts behind colonialism and the impacts that we've had on our First Nations. And in terms of health literacy, I think we need to be making sure that people of all levels of literacy can actually understand what's happening on TV or the billboards or whatever part of journalism we're undertaking or talking about.
I guess
That's enough.
I guess you raise a really important point, though, that health literacy is everywhere. It's not only patients; it's also journalists need to have
totally.
health literacy, and we need to understand better the
So
impacts
do
of
health workers.
colonisation. Yes, okay.
So I've got an impact on health. We're trying to have an impact on health workers,
Yeah.
not to increase the literacy of our clientele or our consumers, but on the way that our messages are delivered as health workers.
Brilliant. Okay, thank you very much, everyone. So we can get our walking shoes on. Come over here. Listen to their. We can. So you've all done your Periscope.